Xin chào quý vị, tôi là giáo sư đại học và trường thuốc tại Cali. Tôi muốn khuyến khích mọi người trong cộng đồng Mỹ gốc Việt khi có cơ hội nên đi chích ngừa bằng bất cứ loại vaccine COVID nào đã được FDA chấp thuận. Một số người Mỹ gốc Việt quan niệm rằng vaccine Johnson & Johnson không an toàn như Pfizer và Moderna. Điều này không đúng. Tuy ba loại vaccine có những mức độ hiệu quả khác nhau, sự hiệu quả là việc dễ bị hiểu sai. Điều tối quan trọng về thuốc chủng ngừa cho các bệnh nguy hiểm như COVID-19 là chúng ngăn ngừa tử vong. Và vaccine Johnson & Johnson có hiệu quả 100% trong việc ngăn ngừa cái chết do COVID. Sự thật là các ba loại vaccine được chấp thuận sử dụng ở Mỹ đều hiệu quả trong việc ngăn ngừa tử vong, cũng như các chứng bệnh nghiêm trọng đưa đến phải nhập viện. Và điều này quan trọng hơn là bị nhiễm nhẹ. Càng nhiều người được chủng ngừa chống COVID càng tốt cho mọi người. Do đó, bất cứ loại vaccine nào cũng rất tốt cho quý vị và cho những người xung quanh quý vị. Cảm ơn quý vị nhiều.
Good evening, everyone, and welcome back to Tâm Sự with Pivot. Tonight we are doing a Tâm Sự with Pivot and UNAVSA. Welcome everyone who's joining us for the stream tonight, or anyone that's watching us after the live stream itself. My name is April Nguyen. I'll be the host/MC for tonight. I am currently the one of the co-chairs for the Young Vietnamese Americans Committee of Pivot, the Progressive Vietnamese American organization. And the president of UNAVSA, the Union of North American Vietnamese Student Associations. Really glad to be here with y'all, and kind of taking Cynthia's lead and telling us that whatever vaccine you get, as long as the vaccine, it's important. We got to realize and recognize that the way that we fight COVID, right, and we get through this pandemic is going to be together and as a community. And so, with that being said, for tonight, we brought a couple of community members with us. From the UNAVSA space, from this Young Vietnamese American professional space, to talk a little bit about why getting the vaccine is important, and hopefully throughout this conversation, we urge and encourage y'all to get others vaccinated as well, right? So, without further ado, I'd like to introduce some of the guests that we've lined up for tonight. My first guest that I have the pleasure of introducing is Dr. April Nguyen, who, as a member of the VSA community since 2010, Dr. April Nguyen is passionate about leveraging her pharmacy and public health backgrounds to promote a better future for the community. She holds almost a decade of experience with UNAVSA, previously serving as the Alumni Relations Director, Collective Philanthropy Project Director, and New England IVSA Council Regional Representatives, in addition to numerous volunteer roles within the community and other nonprofit associations. She enjoys kickboxing, MMA, and is a fierce advocate for positive change in the Vietnamese and pharmacy community. Welcome, Dr. April Nguyen.
Thank you, Philip, and xin chào các bạn.
Great. Thanks, April. Welcome. Our next guest that I'd like to introduce to you all is Charlie Nguyen, who hails from Garden Grove, California. Charlie Nguyen is the Associate Director of Amplify Asian America, a civic engagement organization for and by Asian American young adults, and a member of UNAVSA's Civic Engagement Core Committee. Charlie is currently finishing his Master of Health Science degree in epidemiology at the Johns Hopkins School of Public Health, where he hopes to develop the tools to advocate for the well-being of Viet and immigrant origin communities. Welcome, Charlie.
Thank you so much, Philip. Excited to be here.
Great, thank you. Our next guest that we have in this incredible lineup is Dr. Tu Mai Nguyen. Dr. Tu Mai Nguyen is born and raised Houstonian. I know a little bit about Houston, shout outs. She is currently a physical therapist at a neurological spine center. Her Asian community organizing experience includes serving as UNAVSA's secretary for the 2018-2020 term, and currently serving on the board of directors for Amplify Asian America. She is interested in promoting health justice and equity by increasing access to affordable quality care. Welcome, Dr. Tu Mai Nguyen.
Hi, y'all. Thanks for having me. I'm excited to be here.
Thank you for that, Tumai. And last but not least, we have Dr. Alan Jin, who is, being a part of the VSA community since high school. Dr. Alan Jin is passionate about leveraging his pharmacy and VSA experiences to promote a better future in education and healthcare in his community. Since high school, he has previously served in various VSA/UNAVSA roles, such as UVSA SoCal NGM Mentorship Chair and UNAVSA Alumni Relations Staff. He has a strong interest in researching Asian American Pacific Islander health and disparities regarding its impact on patient care for these communities. Welcome, Dr. Alan Trin.
Thank you, Philip, and thanks for having us. Hello, NGM.
Great. So I'm just gonna throw it back. Okay, yeah, we're all on the screen together. Welcome you all to Tâm Sự with Pivot and UNAVSA for tonight. The meat of our conversation is going to obviously focus on COVID-19. It's actually been a while since we here on this live stream spoke explicitly about the COVID-19 pandemic, right, and of vaccination. I'm really grateful that we have so many inspired and motivated individuals from our UNAVSA VSA community who are so passionate on these issues. One of the first kind of topics just to get everyone kind of situated, right, is to know that a lot of the folks in our young Vietnamese American community, or just the younger generation in general, we know that folks ages 18 to 29 currently have the highest COVID infection rates, right? More 18 to 29-year-olds have gotten COVID than any other age groups per, the CDC. And a new CDC study last week, a new CDC study just released last week with disaggregated data from Hawaii showed that Vietnamese Americans face the second largest rates of COVID-19 among Asian Americans, right? And so, with these metrics and sort of as we set the stage for our conversation, would y'all mind sharing a little bit about how we get folks to not be so hesitant to get the vaccine, right? How we fight this, and what can we do as young Vietnamese Americans?
Yeah, I'll start us off and talking about how we can promote trust in the vaccine. And there's so many things that we can do, all of it that are really important facets. So I'll just touch on a couple that I think are important. But I think number one is that we always want to think about referring to the sources and the top experts on this subject. There's a lot of history about vaccines and viruses, how they work. There's a wealth of information and research to really lean on. I know it can seem overwhelming, but there are a lot of experts who have spent their life working on this that we can look at and that we can back up on. Second, we really want to normalize the vaccine and promote conversation about it. We know that a lot more people feel comfortable when they see their own friends and family get the vaccine. When you see people around you, people you go to work with, and that might actually stick to people more than seeing the celebrities on TV get the vaccine. Now, we want everyone to get it, so I want everyone to get it, celebrity or not. But if you've gotten it, your friends have gotten it, feel free to talk about it. Even talk about the side effects that you got. It's all really normal and part of the experience and conversation to have. Next, I would say that we all might know someone who is a little bit hesitant or unsure or just waiting to find more information, and we're not sure where to go to. Like, I know they're experts, but who should I talk to? Most people feel really comfortable talking to their doctor, the person that they've trusted their health with for many years before. So we don't need to be the experts. You don't have to be your friend's doctor, your family member's doctor, but you can be that support system for them and encourage them to go talk to the people that they do trust to get the information that's right for them. Everyone really is different. So if you hear of someone that hasn't yet gotten the vaccine or is talking about it, even if we feel a little bit frustrated in the moment, we know that coming with that conversation with a little bit of empathy reaches a lot farther than maybe blatant shaming and straight up saying, oh my gosh, why haven't you gotten it yet? Another big issue may be people getting access to it. So in our Vietnamese American community, we do need to be aware about our information reaching people in their native language. People need to have information in their preferred way. So we need to support the organizations, the people doing the hard work, trying to get that out there. And lastly, what I'm going to say to speak to everyone is that in part of normalizing it, we really want to thank people and doing their part. Like Philip said earlier, this is a group effort. So there's getting the vaccine, there's wearing your masks, there's hand washing, there's social distancing, there's so much to do. And I know we've been in it for a really long time, but everything you've done might have really helped someone else not get the virus and not pass away. And that's an important thing to acknowledge. So to everyone on the call, to everyone listening, if you've gotten the vaccine, thank you. If you've been wearing your mask, thank you. You're doing a huge part in this. So let's normalize that this is a thing everyone should be doing. It's not just political. It's not really ideological. It's just a great, healthy thing we can all be doing.
For sure. Thank you for all of that, to my right, like to kind of relist out shortly the points, referring to the sources and top experts. I'm really glad to be amongst you all experts in the field tonight, encouraging people to talk to their doctors, getting the proper information to people in their language, and being able to be grateful for those that have gotten the vaccine, and to know that it takes a community effort, right? I know that we all also come from very differing places across the Vietnamese diaspora. So if anyone else has any experiences about what strategies have been helpful to mitigate vaccine hesitancy, where I definitely want to encourage y'all to speak up, right? Like here on Tâm Sự with Pivot, we've talked a lot about misinformation, disinformation, and how it impacts our parents. So.
Yeah, and Philip, I'd love to jump in on that. I don't know about anyone else, but my folks tend to follow a very specific set of social media kind of news outlets to get their take on, COVID-19, politics, health, and everything in between. They're a big fan of sharing news articles on Facebook without kind of fact checking them. So that's been kind of a struggle for me personally, is to try to even reach out to my own family, let alone the community. Not necessarily to change their mind, but also just try to understand where they're coming from, meet them at their perspective, right? This is a very ongoing conversation. Like Tumai said, this is a community effort. And so even if you see your parents kind of posting certain news articles that may only offer one side of the story, I encourage you to also try to offer alternative links on there, not necessarily to change their mind, but to also reach their friend group and say, these are different and alternative news sources with maybe another perspective. We recognize it's really difficult to challenge some of these deeply seated beliefs that your parents might have, especially with that language barrier, right? So I talked about reaching people in their native language. So Philip's going to pull up Viet COVID, which is a great resource we recommend. It's written by and for the Vietnamese American community. It offers extensive resources in Vietnamese to talk to your parents, your community members, your grandparents. We also have 2 pharmacists on this call too. We're very accessible healthcare providers. You don't need to make an appointment to talk to your friendly neighborhood pharmacist about the vaccine or any questions you might have about it. So we're really excited to see you all watching this live stream tonight. And the video that we kicked off with too is also from the site. So definitely a great resource if y'all have time to check it out.
Great, thanks so much for that, April. And I think maybe we can all speak to these experiences too, right? It's so helpful to have bilingual information readily available to share with your parents, right? And to have something like, hey April, to have something like vietcovid.org, where you can access it in both English or Vietnamese, right? And show people, getting the vaccine, right? And to know that we got for all of us, we've gotten the vaccine and we're still standing, we're still alive. There really shouldn't be anything that folks need to worry about. And I think another point that you brought up too, April, is Viet Fact Check is another incredible resource that is a project of Pivot, the Progressive Vietnamese American organization, right? Where they're very actively looking to fight different topics, right? That such as what the COVID-19 Delta variant is, which we'll get to in a little bit, right? In both English and Vietnamese, so that we can fight this machine that is misinformation, disinformation, right? And I think this kind of segues really nicely into thinking about how the way in which we get our communities all vaccinated, safe from COVID-19, is going to be really intergenerational. Is something that we throw around a lot, right? Especially in UNAVSA. So I mean, how these conversations must be tense in your family. I know it is in mine. I've definitely had a lot of there's been a lot of silence in my family, to say the least, on these sorts of topics. So could y'all speak to some of the intergenerational tensions that arise?
I could talk about this in regards to difficult conversations and tensions in my family. So pretty much at dinner time, I usually talk with my folks about any topics that they have in mind. So recently, like COVID, like, oh, is it safe to get this vaccine and stuff? So a lot of times I refer them to like very strong references. Like I believe if you can, there's the CDC Vietnamese resources website. So on this website, it has a lot of Vietnamese translated resources from COVID to even diabetes and other healthcare health problems in the community. So it's a way for you to conversate with your parents, even though if you have trouble talking about medical terms and such. Unfortunately, as a pharmacist, I use this reference a lot, especially with my patients in the community. And sometimes during these table talks is conversations about their medication or like how they're doing and such. So having an opportunity to talk to your parents and seeing like where they're at with their health and stuff, and like seeing what they see in the media and like trying to help them, like guide them to the correct information as well. So there are some times that's pretty difficult where they don't take the information I give to them, but it's worth the try and effort to like at least let them know like there's other information and like how, at least there's some kind of conversation that you have with your family.
Yeah, thanks for that, Alan. I'm like, you see me over here scrolling through these different topics. Like they got answers about tuberculosis is the first thing, but I mean how the vaccines work, the science behind it, right? Different facts and figures, data, how to prevent it, and you know what's the difference between quarantine and isolation. So I think definitely like having in language resources like this are going to be helpful for us, right? Charlie, I saw you unmute. So.
Oh yeah, thank you for sharing that resource, by the way, Alan. I think that's super helpful. I wanted to uplift the point back earlier about empathy, and that's something that Tumai and I work on a lot when it comes to Amplify Asian America and intergenerational conversations. And I think one of my tips, based on my experience, is definitely check yourself and the baggage that you bring to the conversation, because a lot of times, like, it's easy to get heated in these conversations when there's sort of like that personal element of, oh, like these people are anti-vaxxers, or these people have the opposite political opinion that I have. But, you know, it really comes down to thinking about empathy, recognizing that, you know, it's perfectly human to have hesitance about the vaccine, and really identify what their concerns are, like asking, you know, what are you worried about? And then thinking, you know, if I had this worry, if I had this concern, what would make me feel better about getting the vaccine? And working from there, using the CDC website to get resources to address that specific concern.
Right. Thank you for that, Charlie. And I mean, while I have, you know, while we have both you and Tumai here, would y'all want to talk a little bit about Amplify Asian America and the work that you do, you know, while we're at it? Because I think in the same vein that we're mobilizing and strategizing around how to get folks a vaccine, the other kind of aspect of it is to make sure that they're civically involved, and so that, you know, these important decisions about their health and about their livelihoods aren't made without them. So if y'all wouldn't mind for that.
Yeah, I'd love to jump in. So Amplify Asian America, or sometimes called A3 for short, was born from a sister project under UNAVSA, previously called the 2020 Project, interested in getting Asian Americans and Pacific Islanders registered to vote. And it's really grown into an organization interested in getting the youth Asian community registered to vote, but civically engaged and empowered to take a stance and engage in their local governance. And me personally, I'm really passionate about this. So obviously I'm interested in health equity. And so it's like, okay, why am I helping people to vote? Well, I think that as a healthcare professional, so much about my patients' healthcare is more than just their body, but about what goes on outside of the clinic. So if I really want the best care for my patients, I need to be able to advocate for them inside the clinic and outside. And a lot of times, social determinants of health make a bigger impact. So encouraging people to be active in what's going on, the policies that are being made for healthcare access around their insurance availabilities, all of that is really important and impacts so many things. So that's why I'm really passionate about encouraging civic engagement, and why I think it's really connected to the conversation about health equity as well.
Yeah, thanks for that, Tumai, for sure. And I think, we definitely see the intersection of how all of these issues compound, right? You mentioned the social determinants of health. Charlie talked about empathy. April, you were talking about how we meet people where we're at, right? And so somewhere between us here on this Zoom webinar and the folks out there in the community and the people that are watching today, um, we hope that we can make that sort of connection. I mean, thinking about health equity and these topics around issues around health equity, are there any specific issues that y'all would want to highlight since we have this platform, particularly about the Vietnamese American community?
I'll chime in again, and I could talk so much about health equity, first of all. So if I go on too long, like just feel free to cut me off. It's okay. Anyone chime in. But really around COVID-19, it was really obvious, I think, to everyone that it exacerbated health inequities for a lot of communities of color, especially low-income communities. We saw that early on based off of who could at least access a hospital or access care or get access to a COVID test at the very beginning. And the Asian community alone is already suffering from lack of disaggregated data. So it's even harder to get really good data and robust information about the full extent of inequities in the Vietnamese American community alone versus other Asian American communities. So given that we can't even measure and hold all of this, we need to understand that there's a lot more going on than we already know. And what we know is already a lot, right? So for me, healthcare is really a public service, and that means all humans have a right to health, no matter your race, age, sex, gender, everything. And if you have a right to healthcare, then I think as healthcare professionals, we have a duty to ensure quality access is provided to all individuals, no matter what. I have my personal opinions, and even if someone differs, then I still want the best care for you, and I will still serve you as a physical therapist. I will still give you the best advice and the best care that I can offer. So that includes actually being able to know what are the inequities that impact them. Every single one of my patients are different. They are unique individuals, and it's not just their body that is different, but the situation that they're in, the geography that they're in. So for me, I actually need to know what that is in order to give them the best care.
I know, I'm like, let me just snap over here on the side. Other thoughts on health equity issues that the Vietnamese American is facing, Vietnamese American community faces?
Yeah, something else I wanted to bring up too is how Vietnamese Americans have really limited rates of English proficiency, actually. There's a huge disparity among the amount of folks who actually graduate from college or with degrees. And that's going to limit their access to care, government resources in the pandemic with everything being virtual. Even access to internet, I think, should be something that is readily available to folks. And that's not necessarily the case here. And just speaking of kind of economic and socioeconomic disparities too, a lot of the industries where Vietnamese Americans work are nail salons, hair salons, right? They've been hit particularly hard by lockdowns. Not just in terms of being closed, but also in terms of being limited capacity. Folks come in there kind of spreading a lot of anti-Asian hate. And I think that's something that we really need to acknowledge here is that we're fighting two pandemics, right? Both COVID-19 and racism. And it's okay to feel worried about both the physical and mental safety of your grandparents and loved ones. We talk a lot about living in intergenerational housing, right? So we have family members who work these different jobs, come home, and then have these different difficult conversations with each other. For me personally, I feel like as a childhood refugee, as I'm sure all of you on this call relate to, is our experiences have been really shaped by stories that our parents share, by the generosity of a community that really welcomed them in with open arms. And so it's difficult sometimes to reconcile that America that our parents talked about moving to with the increased incidences of Asian attacks through Stop API hate. And so that's something that I know a lot of folks struggle with. So I want to open up that space too to talk about some of those issues as well.
Oh my gosh, thank you for bringing up like all of these like important points, the both of you, because I feel like what I'm kind of like seeing in both of what you all said is a lot of these are like systemic issues, right? Like there are systems happening that are really impacting our health. And I know you mentioned like having a refugee background. well, like Southeast Asians are vulnerable to, you know, a lot of mental health concerns as well. And that is something that COVID-19 has just compounded. Like we already saw that, I think it was like upwards of like 76% of AAPI folks like didn't receive treatment for mental health care before the pandemic, compared to like 55% like altogether. So especially with how COVID-19 is like impacting the way we work and everything, that is just adding on an additional layer. And thinking of some other systems like incarceration and the immigration system, immigration, a lot of that is just compounding onto health and labor issues as well. I know some of you mentioned like nail salons as well. So I think important to keep in the back of your head that a lot of this is due to structural oppression, and there's a lot of research being done right now that is kind of looking into that. And I want to shout out UNAVSA, our CPP partner this year. We're working with the Asian Prisoner Support Committee, and they actually just released a data report yesterday that really opens up like how some of these structural issues are impacting health, like incarceration and healthcare and everything. So highly recommend all of you search that up if you get a chance.
Snaps, Charlie. I wanted to jump in. I'm really glad that you mentioned that mental health perspective, because I think we all need to also talk about everyone, whether you've gotten COVID or not, how much that has impacted our personal lives, because that physical isolation, that social distancing has actually made it really hard for us. And we know that there are so many things that actually require a community. I think most ethnic communities actually thrive at being family centered. And that's something that we've had to deprive ourselves of to some extent. And if you have other healthcare issues, we know that those who deal with, say, substance abuse actually have a harder time when they're in isolation and getting like rehab care that they need. So there's so many layers to it that I think we forget, that people aren't getting access to the support systems that they need. And we got to really give ourselves some grace and help each other out in what we're lacking in.
Yeah, and for any students who are listening in, definitely want to reach out to y'all and say that this is very unprecedented times. These are not the new normal. You know, you should not be measuring yourself with the same benchmark as other folks have been before you. You're taking classes, you're on Zoom calls all day long. Just let yourself know that rest is meaningful. Don't tie your self-worth to your productivity, because you are enough. And I think that that's something that we kind of forget about sometimes, right? With being isolated, being alone, like Tamai and so many of the other speakers have talked about. It's difficult. We were not made to live in this survival mindset for longer than, you know, maybe a month. Very temporary. When COVID first hit, we were all like, "This is great. We'll be out of lockdown soon." And it's been going on for so long that a lot of us are starting to wear down. And so, yeah, give yourself that grace. Check in with your communities. Check in with your friends. Ask for help if you need it. You know, we're all here to support you as well.
Yeah, for sure. And I want to, you know, plus one to everything that y'all talked about. I want to also say, you know, kudos to you all and to UNAVSA as an organization. I know, you know, Charlie didn't mention it, but he was part of the civic engagement team who put on Vietnamese Advocacy Week this past week, where we really did talk a lot about, you know, these systemic issues that we're facing and the ways that we address them. And at the same time, providing each other with a community space, right, to be able to, you know, to soundboard off of one another and to build community, even though we're virtual, right? And I think, you know, just part of this conversation in general is if we can inspire one person to get the vaccine, or to get more involved in an organization, or to do something that helps, you know, someone in their family, their community, their network, then, you know, that's a really big W, or a really big win for us, right, on behalf of us. And I think, you know, it's really important, and as we're kind of talking about this, to think about how the COVID-19 pandemic is not just about the ways in which our bodies have been affected, right? Our health just being our biological health, but also all these other things that, like y'all talked about, right? Like the economic impact, the mental health impact, the way that, you know, our parents who might be like small business owners or work in nail salons, or who are on the front lines of this, you know, exposure to the pandemic, as well as anti-AAPI hate, you know, experience. So, you know, really glad to hear from y'all about that. So we covered a lot, right? We covered, you know, generally why we as young Vietnamese Americans need to talk about this. How do we mitigate vaccine hesitancy across our communities? The way in which this effort is intergenerational, how it impacts so much more than just our bodily health, right? I want to kind of get into a section. We have some canned questions from our team about some COVID-19 myths, right, or facts, right? We can call this like debunking fact or fiction, right? And since we have a panel of really experienced experts to work through some of this with, maybe we'll give it a shot if that's cool with y'all. So a lot of people are hearing, and I know Tumai mentioned celebrities earlier, right? Like that there are a lot of adverse reactions that people get after getting the vaccine. Nicki Minaj being one of them. What about the reaction? Any adverse reactions to the COVID-19 vaccine, whatever vaccine you get? Like, could y'all speak to that?
I could talk about it. Allergic reactions. A lot is more known about extreme rare allergic reactions that are found earlier on for the vaccination process. Usually people with severe allergies to like certain foods, oral medications, latex, bee stings, and venom could safely receive the COVID-19 vaccines. There are a couple of ingredients, but it's best to talk to your doctor or pharmacist. So go out there and reach out to your doctor or pharmacist to see if there's any interactions in the case. But for the most part, the vaccines are safe if you have an allergic reaction.
Thanks for that, Dr. Alan Trin. The other thing, that has been coming to mind in the media recently, right, are these variants that we keep hearing about, right? These Greek letter variants, Delta, Mu, whatever they are. Could y'all speak a little bit to that and debunk this fact fiction?
Yeah, I know it's pretty hard to keep up with everything because there's always a new variant and a new letter to learn, and it's kind of traveling between countries. But that's kind of the nature of how viruses work and how they survive. So the longer a virus has to survive in the population, and the more hosts, i.e. people or animals, if it's an animal virus, that it has to live on, the greater chances it has to mutate and develop. And that means it has more experience of what we're using to treat it and attack it. And it can learn that, remember that, get stronger. Basically, there's more chances for it to develop resistances to our current treatments or to our vaccine. Now, all that being said, all the current variants that are around, we have found that the vaccines are still wildly effective at preventing death or hospitalization against these variants. So even though the current Delta variant is a lot more contagious, so more people may be more likely to get it, you're still very well protected from dying because the vaccines have been proven to be effective. Now, because there's always a risk of it developing again, that's all the more reason to actually get the vaccine and promote people around you to get the vaccine now so that we can reach a greater herd immunity number much, much sooner.
Thank you for that, Dr. Tumai Nguyen. Another, kind of tying into these variants, right, is the efficacy of the vaccine. How it didn't. There's no way it could have had enough time to go through, the clinical trials or the development needed to produce an effective vaccine. So could y'all speak to the haters of the vaccine on that?
I'll take this one. I'm a pharmacist with experience working in both bench and translational research, which means I work with studies involving both animals as well as human volunteers. Yes, this is very unprecedented. Before this, the fastest route to vaccine development was actually 4 years. But I want to say that all standard safety procedures have been followed in the development of the vaccine. The world in general is actually able to develop this so quickly is because scientists have been studying coronaviruses for over 50 years. So we've got the ability now to fast track research, clinical trials. There was a lot of international collaborations, high interest in volunteers for vaccine studies, which meant we were able to collect a lot of data. They're still being monitored. So we're looking at long-term safety data, long-term efficacy data. And this is how we're able to get multiple vaccines actually authorized through the FDA and receive full FDA approval for both the Pfizer and BioNTech vaccine for individuals who are 16 years old and plus. So definitely, if you have any questions about vaccine efficacy, highly encourage you to get it. Honestly, any adverse reactions that you might get to the first or second dose of the vaccine is not going to compare to long-term effects of COVID-19, which I'm sure Tumai can actually speak about.
yeah, Tumai, do you wanna hop on in here?
Yeah, so I know we're all thinking about COVID and whether or not we get hospitalized or pass away, but we know that a lot of people are dealing with post-COVID effects, and that may not get talked about as much. Like, what are these effects, and like maybe I'll be fine. Are they really that serious? Well, post-COVID symptoms can really range, first of all. There's not really one set of things. There's not enough information to say like you for sure will get this or you won't have this long-term effect. They could be altered sense of taste or smell. It can be extreme fatigue. You can get more fatigue or pain with exertion, such as physical exertion or mental exertion, shortness of breath, coughing, headaches, joint muscle pain, cough, dizziness. They really, really range. It's no cookie cutter post COVID symptom. The main thing to know is that we're not even at the full extent of what we know these symptoms to be, because this is a disease that didn't exist a few years ago, right? So we can't even say what we know will be the symptoms someone is dealing with 10 years down the line, right? So again, all the more reason why it's really important to get it now. We know we have a safe way to prevent getting the disease. Now, for many people who already have been infected and had COVID and are dealing with long COVID effects, there are ways to treat that. So you don't necessarily have to be on the front lines anymore. There are allied health professionals, rehab care. So physical therapy can be a great way to actually work on the symptoms of what you're getting post COVID, whether that's improving your cardiopulmonary system, reducing your pain in your joints and muscles and your musculoskeletal system, things like that. So there are resources. Please reach out to your doctor, to your local physical therapist, to your local nurse, someone that you know and trust that can give you advice on what to deal with your specific symptom that you're dealing with.
Thank you so much for that. I think one of the other things, right, is tonight it's a Friday night, and I know a lot of the VSA folks are oftentimes in this hamjud kind of attitude, right? And usually Tamsu is, with Pivot is a Tamsu Banyao, so I'm sure that there are folks that are out there looking to dance the night away or whatever it is. But there are a lot of very unhome people who think that because they already got COVID, that they should be immune, or that their immune system, they're going to trust their immune system, and that's all that they really need. They don't need a vaccine. What do you say to those people?
Yeah, I can take that one. I think that one is based on it makes sense why people would wonder that, because we learn in school that we get antibodies after we get sick and everything, but it turns out that there's been research, and there's actually just a study that came out based in Kentucky actually that showed that among people who have already gotten infected with COVID, the rate of getting reinfected again was actually more than 2.5 times as high among people who didn't get vaccinated. So even though maybe there might be a little bit of protection afterward, it's not nearly as much as if you were to get vaccinated. So even if you've had COVID, definitely still get the shot.
Thanks for speaking to all those Hamja people tonight, Charlie. I think another thing that I've been hearing, maybe this is in Little Saigon or from my parents' YouTubes, horse drink or ivermectin, right? Does that work? I heard it's on Fox News, so
I can chime in on that. So a lot of times in pharmacy and other health professions, we use guidelines from many years of trials and research. So IUSA, which is the Infectious Disease Society of America, suggests that ivermectin is not suggested for use unless it's used in clinical trials. So pretty much, usually ivermectin is used for antiparasitic infections, and without the proper treatment and using animal dose can lead to poison. So you're more likely to get poisoned with the animal doses and such. But yeah, for certainly the guidelines say that it's against the usage of ivermectin for either inpatient, which is not hospital, or outpatient usage to treat COVID or prevention of it.
While we have you on here, Alan, too, and I know that I know that when we first hopped into the pandemic, my family were talking about all these different treatments to COVID, right? If you drink some ginger tea, you could probably get rid of it, or swayao, or whatever that is. So would you mind speaking to those treatments?
Oh yeah, definitely.
Treatments.
Same thing with my family too, like ginger tea, sun and stuff like that. But a lot of these supplements, such as vitamin C, vitamin D, zinc, elderberry, melatonin even, there's very little or no data on clinical efficacy or safety regarding to the use of preventing or treating COVID. So it's more supplemental usage to like boost your immune system and such. Another treatment that earlier on people started using is hydrochloroquine. The IDSA guidelines say it's against the usage. And so this medication is used for lupus, rheumatoid arthritis, malaria, and such for those treatments. But if this medication is used incorrectly, it can cause cardiac problems and other side effects that may come with this medication as well. But yeah, definitely a lot of people, when I worked in the pharmacy, a lot of supplements. People went out and bought like large amounts of supplements. But yeah.
Mm. And one of the preventative one of the most preventative measures, right? We've got social distancing. We've got a lot of cities and counties are now requiring vaccination records, right? Mask requirements and mask mandates have always been a point of contestation, right? People don't think that they're that they work. Could y'all speak the truth to all the haters out there?
Yeah, I think that's a good question with the mask mandates and everything, because I think there was like a certain period of time when people would always say like masks are meant to help other people prevent them from getting COVID, but it won't like help you. But in reality, masks do protect like you and others as well. And I think another really interesting thing that I think has happened more recently is people think that because we're being asked to wear masks indoors, people are thinking, oh, the vaccine is probably like less effective now and it doesn't work or whatever. But I just wanted to like comment on that and say the truth is like vaccines are meant to protect you from severe illness and death. And that's exactly what they're still doing. And a helpful analogy that I like to use a lot is the vaccine is kind of like a raincoat. And it's like, of course, you'll get wet like in a thunderstorm, like a few drops, but having a mask on is like getting out an umbrella. Like it'll add on to the layers of protection that you'll get.
And just jumping in too, I know folks have been confused about wearing masks, don't wear a mask. CDC has come out with sometimes contradictory announcements and guidelines about what to do in the pandemic. And I want to say that science is all about research and development and learning. It's a very ongoing process. Most people don't see what's going on behind the scenes, but we're seeing it live time right now. We're seeing Dr. Fauci, we're seeing a whole team of immunology experts understanding truly what is the coronavirus, what's really going to help protect the community against it. And so that means sometimes recognizing that maybe a previous recommendation was flawed and now updating it to provide better protection to the community. So I know it can be a little bit confusing, but definitely always feel free to check the CDC website. Any of those websites in Vietnamese as well, they'll usually have the most up-to-date information about what's going to help protect you and your family.
While we have you up here too, April, I think on that, right? Like at first, for a lot of folks that are 12 years and younger, the youth, right? Like it took a while before the vaccine to reach a lot of our youth communities, right? So are there different efficacies or less risky age groups?
Yeah, and I think what you're asking is essentially, we used to think of COVID-19 as a very old person disease, right? You're always worried about your grandparents getting it. You're not as worried about maybe your grandchildren getting it. And I want to highlight that there is no group that is risk-free. We talked about this at the beginning of the webinar too, but the incidence of COVID-19 in the US actually is now highest among adults aged 20 to 29. They represented almost 20% of all confirmed cases through the CDC. So we're talking about some of this misinformation that might be, circulating among you and folks your age. So we really encourage you to get vaccinated, wear that mask, keep yourself and your family safe. It's a little difficult. I know this is, supposed to be like hot girl summer and everyone's ready to travel. But really what you're doing today can help save lives down the line. And so I really commend everyone who is doing their part to help end this pandemic sooner.
Right. Thank you, April. And that's a for me, that's pointing at you, Rave NAVSA. I know all y'all going out there listening to that. Nyak ding. One last question that in this kind of quick fact or fiction debunking is we've got a new recommendation by the CDC for booster shots. So would y'all mind talking about that?
Sounds good. It's actually done today, this Friday. This Friday. So pretty much the CDC recommends Pfizer BioNTech COVID-19 booster shot to increase protection. So the following individuals are pretty much patients who are older than 65, people who live in long-term care facilities, so like nursing homes, patients who are between the ages 50 to 60 with underlying medical conditions, so like immunocompromised and other sorts of problems. Another suggestion was persons or people who are between 18 to 49 years of age may get the booster shot if they have any individual risk factors or it may benefit them. So it may be like if they're immunocompromised, like an underlying medical condition, or they work or are in a medical setting that is a burden to COVID-19 infection. So where increased infections are high. So these include like healthcare workers, teachers, and other essential workers as well. So it's pretty good news. I believe that other news on other vaccines will come on later on, especially with Moderna and Johnson & Johnson later on.
Great, thanks for that, Alan. And again, thank you all for answering our flurry of fact or fiction debunkable questions about COVID-19, the pandemic, and about vaccines. This is, at this point of the Tâm Sự, this is where I want to pass it back to you all. If you have any calls to action that you'd want to urge our listeners live or the folks that are going to listen to this later to do, right, to get involved, to take action in their communities. Whoever it is that would want to go first.
I mean, I think the first call to action, obviously, is if you have not gotten vaccinated, get vaccinated, right? And I think just do your part in your local community and your local family. It may seem like, okay, I'm not a doctor, I'm not a politician, I'm not on the school board of education. Can I do anything to really help people? And actually just having conversations with the people around you is a huge step. I personally like to slip it in. If I see someone and we're about to hug, I actually like to say like, oh, it's great to see you. I'm actually vaccinated. If that's okay, I want you to go ahead and know that. I go ahead and assume that they want to know that information. I care about their health too, right? So talking about it normally and talking about it in your family circle and your friend circle is more than nothing. It's actually really valuable.
And I know we've been talking a lot about individual calls to action, which I do think help. I also want to point out that we talked about, this is a very systemic issue, right? One thing you can definitely do is vote for representatives, legislative members who represent your beliefs around COVID-19, around healthcare, around these systemic inequalities and disparities that we talked about. And that's not just on a federal level, it's also going to be on a local level. You have state elections going on. California recently had a recall election where how to deal with the COVID-19 and mask mandates was a hot topic. And so I want to say that change is also through systems, right? We're not placing the burden entirely on individuals. You are not solely responsible for this. So at times it can feel a little overwhelming with people telling you what to do, what not to do, but recognize, yeah, we're all part of the system and this system can do better. And that's kind of what this webinar is going towards, is how do we make that collective change?
Most definitely. I think it's great to find your advocates in the healthcare profession and other areas of the industry as well. My call to action for y'all is to visit your local pharmacy to get your flu shot that is currently available from August to early February. So get vaccinated and also get your COVID vaccines there too. Pharmacists are very accessible with like immunizations as one part. And then a lot of times we could furnish contraceptives and other healthcare disparities that we could address as well. And again, with COVID, vaccinate, mask up, wash your hands, and do your part.
Yeah, I actually just got my flu shot today, so seconding Alan's little call to action. I think my call to action is, I know some of you watching might be leaders in the VSA space. I'd say definitely like leverage that. And VSAs are a space where we've built community and everything, and those can be spaces where we can learn together. If there are folks who might be hesitant about the vaccine, like really make use of that community to like learn and teach each other and everything, rather than like name calling or like labeling someone an anti-vaxxer, for example.
Thank you all for that and sharing your insights and call to action. Before we close on out, I want to pass it back to y'all one last time. If you could, if folks are looking to for more information, to connect with you all, a little bit about what you're working on and how we amplify y'all, let us know what it is that you'd want to plug.
Yeah, and I can go first. I'm super excited to be on this call tonight and to see a lot of my kind of passions intersect. So as a pharmacist and also UNAVSA alumni, I actually founded Pharmacy Legislative Week 7 years ago. It's now a student-led, student-driven initiative, which really aims to engage and empower students in building healthier communities. And our recent topic and focus this year was to address healthcare disparities with COVID-19. So would love to kind of share my LinkedIn information for folks who are watching, who want to get plugged into these spaces. And you don't have to be a healthcare provider necessarily. We're definitely looking to collaborate across all different spaces and to really build up the community and advocating for better care.
I think from my end, Tumai and I wanted to plug with Amplify Asian America. We've actually been hard at work with our next event for Voter Education Week called Create-a-thon, and it's really an opportunity for folks who are AAPI to really create artwork, attend workshops, and everything to get their community engaged civically. And I think we have workshops from like Wong Fu Productions and a few other ones. So if you're interested, go to apiavote.org/create-a-thon. And we've been collaborating together on that. So definitely check that out.
Alan?
These are great opportunities, whether if you're in the healthcare profession and if you want to do more to your community by joining Amplify America. There's a lot of ways you could be involved in the community and do your part. So go out there, look for the community or an organization that you are passionate about and go and help out, like volunteer your time there, and maybe you'll get an opportunity to grow as a leader as well in these spaces as well. But yeah.
Thanks. Yeah, go ahead, Tumai.
Yeah, for sure. Hopping on the Amplify Asian America train. If you're on social, follow us. Create-a-thon is just one of the many events we have going on. National Voter Registration Day is coming up. So if you're not registered to vote, go ahead and get registered to vote. You can actually do so in 2 minutes with an online application. If you know someone in your life that's not registered to vote, I would advocate for that as well. And then on a super personal thing, it's actually my birthday tomorrow, Saturday. And every year I like to do a personal thing. Thanks, Philip. I like to do a personal request on my social media, and I ask people to do something I think is near and dear, whether it's registering to vote, volunteering in their local communities. This year, I'm going to make a post asking people to advocate against gerrymandering. So Texas is in the process of their redistricting process right now. They're in session, and there's ways that you can submit your public opinion on how you feel these maps should be formatted to be fair, especially for the growth in our communities of color. And that's not being reflected right now. So if you'd like to celebrate my birthday with me, I'd say feel free to take an action around civic engagement, around your local community, whether it be about COVID or anything else that is important to you. That's the best cake that I could get for my birthday.
Thanks. Happy early birthday, Tumai. Thank you everyone for sharing what you're working on, what you do, who you are, as well as your insights and wisdom on the COVID-19 pandemic and the vaccines for tonight. It's been my pleasure to be here with you all experts. And my plug as before we close out is that if it really, all it takes is that first step for you to get involved, whether that be with a different organization like Pivot or like UNAVSA, or that first step to pushing your parents, aunts, uncles, elders to get that vaccine that they haven't gotten yet, that they've been waiting on for whatever reason. Go ahead and do it, right? And with that, I'd like to one more time thank all of our panelists, amazing panelists, for hopping on Tâm Sự with Pivot and UNAVSA tonight. And to everyone watching now and later, thank you all for being a part of this conversation. Good night, everyone.